Hey there, it's Wong. I just wanted to make a quick video to talk to you a little bit about a case that we had earlier today and how I was training my own therapist, and I thought it would be really helpful and useful to you as well, so I wanted to share. So we have a case. Now, the case said it was a thumb sprain. Okay, so this is what happens a lot of times if you're working in hands and you're working in outpatient. This might even happen to you if you're working no matter what setting you're in. Basically, the quote-unquote diagnosis was one thing and the patient came in with something else, right? So for example, the case that we had, she was a thumb sprain. She was in a car accident, and she sprained her thumb, and she tried a few things before, it didn't work. And so when she came in, she actually came in post-surgical, okay? So it's a ligament repair, and she had an extensive history of several months of therapy, conservative treatment, didn't work, and then she just recently had a surgery. Now what happens is, in your mind you thought it was a sprain, so in your mind you're like, oh, I'm just gonna work on to find out what her pain was. Maybe you're thinking, what kind of testing do I need to do? Is there any provocative testing that I need to do? But then she came in as something completely different, right? So she's post-surgical. Now, I always say that when they're post-surgical, it's so much easier because you don't have to guess, like, what happened. You know what happened. She had surgery, and you know exactly where she had surgery because of where the incisions are, right? So, happened to be, let me see if I have a pen here. Ooh, I don't want to write. Permanent marker. She had a pen. She had surgery right there. The ulnar, oh no, sorry. She had surgery here. Ulnar side. So she had an ulnar collateral ligament surgery of her MP thumb, right? Now, if you don't know anything at all about what to do, what should you be doing first, right? So this is what I want to talk you through. If you don't know exactly what that injury is or exactly what that surgery is, what do you do right at that moment? So right at that moment, you want to, first of all, in an evaluation, you're getting their story. What happened, all the nuances, dates, and stuff like that. What they tried, what worked, what didn't work. And then you want to know when she had the surgery and what's most important to her, you know. If she was in a car accident, so this is a workers' comp injury, so she was in a car accident, but what does she do for a living so that you know what you need to do to get her back to it? Is she currently working, or is she not working at all? Is she working light duty? So you can know exactly where she's at in terms of her level of activity and where you're trying to get her to, right? So after that, you're looking at objectively what kind of measurements you need to be taking. First of all, pain. You need to know where her pain level is, right? And then what do you need to look at? Range of motion, right? So you need to take range of motion measurements, IP, MP, and then you want to take a look at CMC. So CMC is not it's a difficult one. The way you take CMC is really through opposition. Can she oppose, and then can she slide all the way down? Because then that's going to allow full CMC motion. And you might even take a look at her wrists. Make sure that her wrist is within normal limits. And then after that, you have to ask yourself, am I allowed to take strength measurements? Well, that would be based on how long ago was her injury. So it was, if it's 6 weeks, she's allowed to move, and she might not be allowed to strengthen. So if you're unsure, just say to be assessed. But if it's been like a long time, if it's been past like a protocol period and you're not sure, right? So I'm talking like if you're not sure, don't take the grip measurements because that requires a certain amount of strength. But if you take a look at the strength, it's really in the fingers. The thumb doesn't do like a ton. So you can actually take the measurement and say, oh, well, just whatever you can tolerate, but with no pain. So you can get measurements of what her fingers can do, but then she might not use all her thumb. Tip would be a lot harder, right? Like if you're taking pinch strength, it'd be very difficult. So you might not want to take it if you don't know. So the first day, really, if you're not exactly sure, go through the full evaluation, take whatever measurements you can, story, objectives, and then creating the plan of care. You're going to create the plan of care based on post-surgical patients. So you might see your patients twice a week, 3 times a week. So in this case, we're seeing her 3 times a week. There's a workers' comp case, and so it's 3 times a week until she goes back to her doctor, or maybe it's however many authorized visits you have. And you don't have to go into further detail until you go back after the evaluation and study about that particular case. The first day is always about, what are the basic things? You don't need to know everything on the very, very first day. And you want to make sure your patient trusts you. So you're not going to be like, oh, I'm not really sure what happened to you. I'm not really sure the protocol. What you do know is that you're allowed to start moving right now. You don't want to do anything passive because it's a ligament repair. So you want to just be able to get yourself through the first day, and then after that, then you're going to go back and you're going to say like, okay, now I know it's an ulnar collateral ligament repair of the MP. What can I do? What are my precautions? And all of that stuff. What am I allowed to do based on the timeline? So usually with ligament repairs, you don't want to do any passive range of motion stuff for a good 6 to 8 weeks. Right? Because you actually want them to be really stiff before you start doing any passive range of motion. So for several visits, do tons of active range of motion, get full active range of motion, and then after that, usually about so many weeks into it, then you can start some passive range of motion, some light strengthening. And we can go into that a little bit more later, but for now, if it's something you're not really sure of, then you get the basic information. And then if you have like a second, you can always run back, look things up really quickly, and then get a better handle on. But if you're not sure and it's the very first day, just deal with it for what it is on that first day. But just get your story, get you started on your objective measurements so you know where you are today, so I can take you down that path to full recovery, so you can get to driving, so you can get to riding, so you can do everything you want pain-free, okay? And the way that's going to look is we're going to start really slow. We're not going to do anything aggressive today, and we're just going to get you started to move, work on your scar, your edema, reduce your pain, and then you're just going to move gently through the motion and start with that. Start nice and light until our next visit, and then each week we're going to progress a certain way, right? But at least that gives you get buy-in, you get trust, and they're going to want to come back to you. And then between the time they come back to you, and now you get to go home and you get to study about what you can do next, right? So just as your patients have to take it one step at a time, you too have to take it one step at a time until you know more and more and more and more. And then you build your confidence and you build your skills, and then you're ready for it the next time it comes. All right, I hope that helps you. I will talk to you soon.
Hey therapy friends, it's Huang here. Thanks again for watching my video. And if you like videos like this that can help you just crush it in the hand therapy world as an occupational therapist, then hit the subscribe button and enjoy the video. Thanks again for watching.